Hello, hello, good morning. Actually, gosh, I'm a little bit late today. It's Monday morning, and it's about 12 o'clock my time on the Pacific Coast. And once again, my name is Elliott Martin. I cover Medicare topics of the day, different Medicare topics on these videos, short videos, 5 to 10 minutes, explaining different little nuances to Medicare. Excuse me. Today, I'm going to be talking about tips on working with the Social Security Administration to enroll into Medicare. So going in, a lot of people aren't aware that they have to actually go through the Social Security Administration to enroll and apply for your different parts, at least Part A and Part B of Medicare. Those two parts, A and B, make up what's called Original Medicare. Those are the two parts you qualify for based on your taxes, paying your Medicare and Social Security tax. You then qualify for Medicare at age 65. And so you actually initiate contact with the Social Security Administration. Now, if you're applying for Medicare when you're just turning age 65, the process is very simple. You can pretty much do everything online through the Social Security website, which is ssa.gov. And you need to create an account. I think it's called a My Social Security account. Once you have that account, you can go ahead and apply for Medicare. And that's a very simple process. If you're applying during your initial enrollment period, so 3 months before you turn 65, the month you turn 65, or even 3 months after you turn 65, you can do everything online at that point. Okay, where it becomes a little bit more complicated is if you've delayed Medicare, let's say Part B, which a lot of folks will do if they've been on employer group insurance, is they'll delay Part B of Medicare until a later date when they retire. They're going to be losing their employer group insurance, and they need to make the switch to Medicare. The process is a little bit different. You actually have to get certain documents over to the Social Security Administration. One of the tips that I would suggest is start the process up to 90 days in advance. So within the 3 months before you need Medicare to kick in, you can actually initiate applications and initiate conversations with Social Security to get help applying for Medicare. So start that process as early in that 90-day window as possible. You can even book an appointment well in advance. A lot of times, Social Security can't book phone appointments with you. The wait times could be a month and a half, 2 months even, before you can schedule or before you can get a phone call with Social Security. So start the process earlier. Social Security, they work hard, but they're understaffed and really overworked. And it's hard for them to keep up sometimes with all these documents being sent in and getting everything completed in a timely manner. Especially, what I've noticed is around the holidays and into the new year, wait times are a lot longer on getting things turned around from the Social Security Administration. So start that process as early as possible, well in advance. Don't wait till the last week. If you need Medicare to kick in next week, it can be done, but it is a tight window. So you want to give the folks over at Social Security as much time as possible. The other tip that I have is to be able to check in on the status of your Medicare enrollment. And I'll cover kind of the different documents that you need to submit in maybe a different video. But one of the ways you'll be able to check in on the status of your Medicare application, if you are having to send in these documents to show proof you've been covered by your employer insurance, check the status, create an account online. It's ssa.gov. So that's the government website where you can create a My Social Security account. You can actually see the status and see the updates that Social Security has for you on your Medicare enrollment. You can see, okay, it's step 1 of 3 is complete, step 2 of 3, whatever the steps are there. So create an account online with the Social Security Administration. The other thing is if you are waiting or if you have applied, make sure and check in on the status or call for the status of your Medicare, because a lot of times Social Security may need an extra, a copy of a marriage certificate, naturalization papers, birth certificates. There's all sorts of things that they might need that they don't have. And a lot of times they'll try and reach out, but if they're not able to contact you, there's no way for you to know what documents they need. So make sure and stay on top of it. Call your local Social Security office, or if there's another Social Security office that that's handling your enrollment into Medicare, make sure and contact that office. because that you'll be able to make sure nothing is slipping through the cracks. We don't want you to check in on things and just to find out that, Social Security has been waiting 2 months to receive a naturalization paper or document. So you just want to stay on top of it that way as well. So, when it comes to Medicare enrolling, you have to enroll through the Social Security Administration. Start the process, start doing your research well in advance of when you need Medicare to kick in, because if you're coming down to the deadline, you're not going to get approved. You may get your coverage backdated, but if you need Medicare to kick in a couple days, they probably won't process it, at least for I don't know what they're saying. I've seen 2 weeks, 3 weeks, a month, and they'll backdate your coverage, but you'd rather not have to do that. Where, if you go to the doctor, you might have to pay out of pocket if you don't have Part B in effect. And then, Medicare, usually if you start the application before the end of a month, they'll give you a first of the month effective date for that following month. But you don't want to have to submit claims to Medicare. Just, it adds some complexity. So plan it out, start it well in advance. When you are needing Medicare to kick in, you can start that application process 90 days in advance of when you need it to go into effect, I believe. And, start with a phone call over to your local Social Security office. So those are my tips when having to work with the Social Security Administration to enroll into Medicare, original Medicare A and B. And then obviously once you have that set up, you can then start looking at Medicare supplement insurance, prescription drug plans, Medicare Advantage, kind of the things that go in addition to your Medicare benefits. Okay, so start the process early. And that is the Medicare topic of today. Thank you so much for tuning in. I'll be covering kind of the different documents you may need in another video. I already have, I think, a number of videos on the different documents you'll need. Yeah, if you go to episode 6, I think I have, episode 6 on my Medicare topic of the day. You can see, I think in that video, I cover the different documents that you would need if you've delayed Medicare Part B past age 65. That video will explain it. That's episode 6. Okay, thank you so much for tuning in. We'll see you next tomorrow. I should be back on tomorrow, hopefully at my normal time. And we'll see you then. Let me know if you have any questions. You can visit us at martinmedicare.com. That's martinmedicare.com. And thank you for tuning in. Take care.